Thank you very much. Good morning. My name is Oana Inescu. I'm an infectious disease specialist at the National Institute for Infectious Disease, Professor Dr. Matei Bals in Bucharest, Romania. And today I will speak about HIV-related knowledge, attitudes, and stigma among Romanian nurses. I have no conflicts of interest, and in the beginning I want to speak a little bit about stigma, because stigma is a social process involving labeling, stereotyping, and discrimination that leads to social exclusion and reduced access to healthcare. In the context of HIV, stigma remains one of the most significant barriers to prevention, testing, and also treatment, and it affects both individual behavior but also health system performance. Healthcare-related stigma is defined as negative attitudes, prejudicial behaviors, or discriminatory actions by healthcare workers towards people living with HIV. It manifests through fear of infection or exaggerated perception of occupational risk, overuse of infection control measures, avoidance behaviors or differential treatment for people living with HIV, and moral judgment or a breach of confidentiality. These behaviors compromise quality of care, patient safety, and trust in our healthcare system. WHO and the ECDC identify stigma in healthcare as a key structural barrier achieving the 99-99-99 target. So, we have the target for 2030 here. So, we want 95% of our patients aware of their HIV status, of which 95% on HIV treatment, of which 95% on virally suppressed, but very, very important, with zero discrimination. Nurses. In HIV care, nursing involvement extends well beyond infection control. Theoretically, our nurses act as educators, advocates, care coordinators, and frontline implementers of public health interventions. So, let's detail a little bit more. Educators, because they are providing counseling on treatment, adherence, transmission, and prevention. Advocates, because they are ensuring people living with HIV receive respectful equipment and equitable treatment. Care coordinators, because they are connecting multidisciplinary teams. And frontline implementers of public health intervention, including testing, PrEP, and PEP. Evidence consistently shows that when nurses are well-trained and integrated into HIV care teams, they can effectively reduce stigma and improve engagement in care. Now, let's talk a little bit about international models of nursing involving in HIV care. And we'll start with the United States. In the USA, advanced practice nurses provide HIV management in outpatient clinics and primary care. Studies have demonstrated that nurse-managed HIV clinics achieve viral suppression rates equivalent to physician-led models while maintaining higher patient satisfaction. Nurses routinely deliver HIV testing, initiate antiretroviral treatment, monitor comorbidities, and lead adherence programs. In Canada, task shifting towards nurse practitioners have been particularly successful in improving access to care. And here you have a very interesting article. The PrEP-RN study explored patient perspectives on a nurse-driven PrEP program in Ottawa. Participants described nurses as approachable, non-judgmental, and central to fostering trust and adherence. The study showed that nurses can independently assess eligibility, initiate PrEP, provide follow-up, and offer counseling. The UK has a well-defined structure of HIV specialist nurses who provide comprehensive and continuing care across both hospital and also community settings. They have a central role in counseling, sexual health education, management of comorbidities, and the long-term follow-up of stable people living with HIV. A 2017 study on how specialist nursing contributes to HIV service delivery across England highlights that these nurses significantly contribute to patient retention in care and reduction of perceived stigma. Now, in Australia, nursing practice in HIV has evolved with the implementation of national HIV guideline. And the Australian HIV management guideline from 2024 described nurses as essential providers of ongoing psychosocial, clinical, and preventive care. Community-based HIV nurse roles also integrate mental health and chronic disease management, bridging primary and specialist care. In the Netherlands and Nordic countries, nurses often act as case managers, conducting regular follow-up and providing education on U equals U and antiretroviral treatment adherence. In Eastern Europe, in countries such as Ukraine and Poland, nurse-led clinics are shared care models are emerging, increasing testing coverage and improving linkage to antiretroviral treatment initiation. In all these contexts, specialist training programs and continuous professional development in HIV nursing are standard practice. Nursing against AIDS is not just a phrase. It represents the commitment of healthcare professionals to provide comprehensive and compassionate care to those affected by HIV. And here you have the first page of that blog. Nurses work tirelessly to ensure that patients receive the best possible care, and not only for their physical health, but also for their emotional and mental well-being. Last but not least, Romania. In Romania, we don't have specialized HIV nursing education. Their roles are largely procedural, like blood collection, wound care, and medication administration, and they are not routinely included in multidisciplinary HIV care planning or education programs. If a nurse learns that a patient is HIV positive, maybe this information triggers fear and over-precautionary behaviors like double gloving or unnecessary isolation, or maybe avoidance of physical contact. These behaviors reflect on systemic gap in training and an absence of institutional stigma reduction programs. So, about our study, between September and December 2023, ECDC and EX carried out a survey addressing HIV-related stigma in healthcare settings. If you scan this QR code, you can find the official report of the survey. Okay, for the whole project gathered more than 18,000 responses from 54 countries. 44% were doctors, 22% were nurses, and 74% were female. In Romania, we have 2,618 respondents. 69% were doctors, 76% were female, and only 6.7% nurses, with a prior care for people living with HIV on 57. Knowledge domain for our study, U equals U, undetectable means untransmittable, post-exposure prophylaxis, and pre-exposure prophylaxis. And our score system was -3 to 3 points, plus 3 points, and the good knowledge is 1 or above. Good. As knowledge results among our Romanian nurses, 43% of our nurses knew that U equals U, 60% knew about PEP, and only 8.5% knew about PrEP. These results point to substantial knowledge gaps, particularly in prevention strategies. About fear and avoidance, when asked which procedures they most feared or avoid, when caring people with HIV, over half mentioned wound care, 55%, and blood drawing, 54%. These are precisely the procedures most associated with the perceived risk of exposure, and this reinforces the link between limited HIV knowledge and fear-based practice. About frequent infection prevention and control practices, 83% of our nurses wear gloves for all care, 33% wear double gloving, and 60% have special IPC measures. Finally, we compare practices among nurses with and without prior experience caring for people living with HIV, and the proportions were nearly identical. For example, 93% versus 87% wear gloves for all care, 43% versus 42% use double gloving, 10% versus 12% avoiding physical contact, and 63% versus 73% about special IPC measures. None of these differences were statistically significant, and this tells us that the experience alone doesn't correct misconception or reduce stigma-driven practices, but we need education and structured training. In conclusion, Romanian nurses exhibited limited knowledge about HIV and key prevention concepts such as U equals EU and PrEP, which was in turn associated with excessive IPC practices applied to care. The presence of these practices, regardless of prior experience with people living with HIV, highlights important areas of focus for strengthening HIV-related training and professional development for nurses in Romania. Thank you.